Meet Mr. West. And meet Sam, orthopedic trainee. Mr. West was examined by Sam for his knee pain. Mr. West was recommended surgery. He was sent to pre-assessment unit to see Sarah, anesthetic trainee. Mr. West had diabetes and took tablets and insulin with his dinner to control his blood sugars. Mr. West was advised to skip his glycoside and fast for 6 hours prior to surgery. He was booked for the morning list. A week later, Mr. West arrived on the day of surgery. He had skipped his tablets and fasted as advised. He waited for several hours for his turn. He had missed both his breakfast and lunch. Finally, Mr. West was operated under spinal. Mr. West became unwell and stopped responding towards the end of the surgery. Blood glucose testing confirmed hypoglycemia at 1.9. Sarah called for urgent help to treat Mr. West. Mr. West is now treated and recovered from hypo. But how did he develop a severe hypo during surgery? What went wrong? Sarah, you saw Mr. West at pre-assessment unit. Did you tell him to reduce his insulin by 20% the day prior to surgery? Sam, Mr. West had diabetes. Did you consider to keep him on the initial third of the operating list? Joe, did you check hourly blood glucose levels from the time of admission? Remember, careful planning is required for patients with diabetes at all stages of surgery. Could you have planned the surgery better? During pre-assessment, review patients' glycemic control. Where possible, aim for HbA1c less than 8.5%. Always adjust the dose of insulin and oral agents for the surgery. If you are not sure, check hospital guidance. You should give patient information leaflets to help adjust medication. On the day of surgery, to minimize the duration of starvation, keep the patients with diabetes on the initial third of the operating list. Consider intravenous insulin infusion in patients with poor control, or in those missing more than one meal, or in an emergency. Before and during surgery, make sure you check hourly blood glucose levels. Aim for levels between 6 and 10. Consider treatment if levels are outside the acceptable range. For instance, for levels below 6 in presence of symptoms, give 50 ml of 20% dextrose. If the readings are below 4, give 100 ml of 20% dextrose. Check blood glucose in 10 minutes. Likewise, if blood glucose is above 12, consider stat dose of rapid-acting analog insulin. You should also check for ketones. Ensure that the ketone levels are low and acceptable before proceeding with surgery. After surgery, check hourly blood glucose levels, encourage early return to normal eating, and recommence insulin and oral agents. Remember, careful planning is required for patients with diabetes at all stages of surgery.